In this video, I am going to walk through kind of the common responses to our patient separation process and explaining it to caregivers and kind of why we do it. It is a unique process and we do acknowledge that, but it is meant for the safety and security of both our patients and the caregivers that are here at PAW Health Network. When patients arrive with their caregivers, what's going to happen is caregiver support greets them at the reception area. They provide them our check-in paperwork to get that started, and then we escort their patients safely into our treatment area. From there, medical staff takes over. They're going to go through their initial evaluation process, and they're going to properly house and monitor the patients that are here. It allows us the opportunity to get a better understanding of that patient's status within a very short amount of time, and then obviously properly triaged as well. Caregivers aren't necessarily exposed to it or ready for it when they are here with their patients. So we want to make sure that we educate them on patient separation on the phone as well as when they're here in person, so that they're comfortable with the process as much as possible, or at the very least that they understand why it is that we do. First off is going to be safety and security. We want to make sure that patients and caregivers and our staff are all as safe as possible during the entire duration of that patient's visit. And the best way that we can do that is to have them handled by trained professionals. It also limits the opportunity for patients to engage with one another. Each patient is individually handled and individually housed. The second reason that we have our patient separation process is for our initial evaluation and triaging process. When patients enter into the treatment area, they are placed into one of the bays so that they can be evaluated by medical staff within about the first 15 minutes of them being here. So we have a much more accurate understanding of that patient's status than we did previous that information being acquired. And then we can properly triage them from there. Third reason that we utilize a patient separation process is accessibility to care. Time is of the essence, so the closer that they are to that care process, the better. This also helps us increase efficiency of clinic processes because of the fact that we are running diagnostics and we have to acquire samples and then also administer medications or treatments. The closer that those patients are to the care process, the more efficiently they are able to receive that care. One thing that we have found is that in the patient separation process, canine patients actually tend to relax quite a bit more than when they are proximate to their caregivers. One of the ways that I've worded this to caregivers in the past is going to the vet is a stressful experience for the patient and for the caregiver, but for the patient, when they are able to experience the process on their own, rather than having to feel as though they have to protect their caregiver from the person with the sharp objects, it actually tends to be a significantly less stressful experience for them. The fifth reason that we utilize our patient separation process is going to be for allergen and contagion isolation. So if we have a patient that maybe is potentially contagious to other patients, we do have our isolation process, which we go through in a different video, but also from an allergens perspective, not every caregiver isn't going to be allergic to pet dander or maybe long hair or something like that. So the more distance that we put between patients and a general group of caregivers, the more isolated they will be from those allergens. And the last reason that we utilize our patient separation process is general cleanliness. Canine, feline, other types of patients sometimes will excrete their waste during a visit here at PAW Health Network, and if they are able to do that within our treatment area, we are able to limit the exposure of our caregivers to that, as well as the cleaning up of those events. It does happen a lot quicker and a lot safer within our treatment area than it does within the lobby or reception area. So overall, the patient separation process is something that we do deliberately to maximize the patient's care experience here at PAW Health Network. We want to make sure that we are able to maintain their safety, accessibility to care, as well as the caregiver's safety and accessibility to a comfortable environment while they are here at PAW. If a caregiver does ever have continuous questions, or maybe just is hoping for an introduction to our patient separation process at point of check-in, we do have these laminated kind of walkthroughs that kind of explain everything that I just went over with you. I also have that linked in the description for your review, but don't be afraid to hand those out so that they can review them. Just make sure that we disinfect the forms as they are used. But that's patient separation, so you can now explain that to your caregivers that are on the phone as well as in person here at PAW Health.